Hello, good morning. We are here to discuss how to take a history from a patient with palpitation. Before I take you through the history taking, I'd like to tell you that there are a few steps you need to memorize before taking history. This should be firstly, you need to ask about history, complaints, and then past medical history, personnel, medication, allergy, family, travel, occupational, social, and any other things he would like to ask you. And then after that, you need to get a general idea of differential diagnosis so that you can get narrowed down to the final diagnosis. If a patient present with palpitation, you need to ask the day history about this cheek complaint. For how long have you had this palpitation? And do you experience them all the time, or are they on and off? Have you noticed anything that brings them on, and have you noticed anything that makes the palpitation better? Is this time the first time or recurrent? Do you feel the palpitations are getting worse or better? Is there any particular time of the day you experience them? Are the palpitations better in any particular position? This the history of his complaint, and then after that you need to rule out the differential diagnosis by asking, do you feel hot when others are comfortable, and do you have diarrhea, and do you have a recent weight loss, and do you notice any traumas? Are you taking any medications like inhalers? Do you have any medical problems like diabetes and high blood pressures? When you are having palpitation, do you notice shortness of breath? Do you experience any tingling around your lips, and do you get the feeling that you are going to die? And do you have any heart problems like angina and any heart attacks in the past? And do you experience headache or tummy pains at the same time as the palpitation? Have you noticed that your urine is turning dark in color? Are the palpitations on and off, or are they constant? Do you drink a lot of coffee or tea? And do you suffer from lightheadedness, weakness, or tiredness? Is there any chance that you could be using recreational drugs? These are the questions to rule out the differential diagnosis of hypothyroidism, medication, hypoglycemia, anxiety, panic attack, arrhythmia, pheochromocytoma, anemia, drugs abuse, and coffee and tea intake, ventricular atopies, and then anorexia nervosa. After that, you can get your diagnosis. Okay, this for now, and then you need to ask the question in the sequence of past medical history, personal history, medication history, allergy history, family, travel, occupational, social, and then anything else like that. For example, as for medication history, do you have any medical conditions? Have you ever been admitted to the hospital for any reason? Have you had any operations performed on you? Do you have any medical conditions like asthma, high blood pressure, high blood sugar, heart problems, epilepsy, stroke, personal history, you're asking personal history, you need to get you need to do an introduction to this history, this question. I would like to ask you a few personal questions. Is that okay for you? Now, if there's any chance you use recreational dress, but if you want to ask sexual history, you do the same. I would like to ask a few personal questions. Is that alright? Are you? If it is okay for him or her, you can proceed your questions. Are you sexually active? Is your partner male or female? To practice it safe, do you use condoms? And how many sexual partners have you had in the past year? And do you currently have one partner or more than one? And do you ever had a sexually transmitted disease? And have you ever been tested on HIV? This sexual history might not be relevant in this case, and because it is not a case of sexually transmitted disease. So this might be up to your case. For females, you want to ask. You may want to ask about how was your last menstrual period? Are your periods normally regular? How many days do you bleed? How many days between periods? Do you pass any clothes? Are your periods heavy? What was your last cervical smear? What were the results of your cervical smear? Do you use any types of contraception? If she says any particular question to yes, you need to ask detail of this question, like which contraception are you using, like that. Medication history, you need to ask, are you taking any regular medication or any over-the-counter medications? Are you on any types of contraception? Allergy history, are you allergic to anything or any medications? If yes, you need to explore explore the details about it by asking what happens when you take it. In family history, anyone in the family with similar conditions or problems, and anyone in the family with heart problems, high blood pressure, high blood sugars, or asthma. In the travel history, it is next by asking, have you traveled abroad recently? And occupational history, you need to ask, what do you do for the living? If he said he doesn't do anything, that doesn't make sense. So you need to ask about, are you retired, and what did you used to do for the living? And then for social history, you need to ask, who do you live with? And do you live in a house or bungalow? And do you work independently? This might be an important questions for your clinical management. Is there anything that causing you stress in your life? Are you married? Do you have any children? Do you smoke? If he says no, you don't stop there. You need to ask if he or she has ever smoked. There might be case that he stopped smoking 2 days ago. So if he says no, don't take no for the answer. and to drink alcohol, the single false alcohol. Has it affected you at home or at work? Is there anything after all these questions you need to, before concluding your history taking, you need to ask him or her that is there anything else you would like to tell me about your condition? By asking his question, by asking this question, you can get any mispoint why you are asking the questions. That's a good questions. That's important for not to forget. Okay, that's all for now.